Welcome. Please, if you are joining me, share the program. If you are joining me, share the program. Can you people hear me very well? I don't want to shout because of my baby. As you can see, I change location. I always change location. I'm looking for a better place. So the topic you saw there is what we are going to treat today. Please share this program. This topic is very, very important. Women and infertility. That is what we are going to look into. I might be a bit distracted due to the baby, but we will continue. So today we are going to look at infertility in women and the solution. We are going to do a recipe here live. I don't have time to be doing it separately, but I'm going to demonstrate it live. It's very simple. So if you want to learn this recipe, please stay tuned. Do not come and go. If you want to learn, always stay here and learn, so that you will practice what you learn. It will work for you. Hello, Wachuku, you are welcome. Good morning from my side. My sister, you are welcome. Francine Chanda. Hi, Dochi. Dochi Chanda, how is the baby? The baby is doing well. So I welcome you all. Please, as you are joining me, share the program. Share the program. We are 11 already. We will start. I will not waste time. I always do fast now. It's not like before that I waste time in talking. I will not waste time. I'll just go straight to this video. Now, we are talking about infertility in women and the solution. And this has been a very big problem, burden to many women. They have been trying for years, and nothing is happening. So we are going to look at the causes of this infertility in women. Is it the way God wants it? Then we'll prefer a solution known to human, not by God. God has the final say. Now, what is infertility? Or when would you say that a woman is considered infertile? Please just be clicking on that like button. I want a lot of people to be here, because many people need this video, especially those who have fibroid and the rest. They need, just be clicking on the like button, share, so that people will come in and learn. I'm tired of typing and responding to questions. So when is a woman considered to be infertile? A woman is considered to be infertile when you have continuous unprotected sex with a man up to a year, 1 year, and you didn't become pregnant. That is when you will notice, or you'll be considered infertile. If you're under 30s, you are allowed to sleep with a man for a year. If nothing happens, then you should visit your gynecologist. If you're a woman under 35 to 40, 6 months, 35, not 40. 40, you don't need to wait. 35 and up to 6 months, you sleep with a man unprotected and you didn't become pregnant. At that particular moment, you will be considered infertile. Infertility does not mean, sometimes people misunderstand infertility. Infertility does not mean that you will never give birth again. No, it doesn't mean that you all your life you can't become pregnant. No, that particular moment you have been sleeping with a man from January to December, you didn't become pregnant. That year, those months is being considered infertile days and months in your life. It doesn't mean that you will not become pregnant again. Now we are going to look at what are the causes of this infertility in woman, because naturally God created, if you look at the book of Genesis, when God created the world, he said to Adam and Eve, go into the world and multiply. And now you find out that majority of the women, when they get married or when they desire children, they don't get them. Now what is the reason? What could be the possible reason? Also, although some infertility is unforeseen, there is some cases that a couple will go for a test. Both of them will be declared by the physician that they are good, but yet they cannot have a baby. Now what is the cause? But we are looking at general causes of infertility. Number one is tube or tuber blockage. Remember, I always talk about tuber blockage. When you hear tuber blockage, it's something as a fallopian tube blockage. Number one cause of infertility in women is fallopian tube blockage, or you say tuber blockage. And what does it mean? I would say that this is the highest challenge or the highest infertility a woman can have. But thank God and thanks to science who made it possible now that women with fallopian tube blockage, they can become pregnant. So now when you have tuber blockage, every woman have two tubes. And what is the role of these tubes? If you have been following me, all these things I'm saying now shouldn't or won't be a new thing to you. I am not happy that people are not here, because after this life, they will come and be asking me questions on Messenger, and I don't have time to reply. Even the comment section, if you look, I don't always reply because you won't blame me. I'm very, very busy. This is the little time I have. Why not fix always every day 2 p.m. African time, Central European time, fix every 2 p.m. Be ready for Tochi channel. Then if you didn't see me, if I post video, you watch it. Please, I need people to always come here. Have it in mind that Tochi channel always comes live every 2 p.m. Bright Daniel, is like this is your first time coming here. When you come here and I am teaching, please pay attention. Don't ask me question. If not, your name sounds strange. That is why I will not block you. I always give opportunity for question. I'm going to demonstrate something to show you something that you can use to talk about or heal all these things that I'll be mentioning here. If you like, stay. If you don't like, you can be coming and going. So please click on the share button, or did I say share? Yeah, share button and the like button. It helps to notify people so that they will come and learn, because sometimes people think that I don't like or want to answer their question. Time is not by my side. I have how many children here? I am alone. I do everything alone. This is the little time I have that I come to spend with you. Please share and like so that people will come and learn. So I talked about number one causes of infertility in women. Why is it that some women are not getting pregnant? No matter what they take, no matter anywhere they go, what are the main causes and of infertility? And another problem of people not getting pregnant is that some people that are not getting pregnant have problems, but they don't know that they have problems. They will keep on believing, hoping, accusing those that they can accuse, not knowing that they have something that is disturbing them. Once that thing is cleared, then they will become pregnant. So the number one I talked about, fallopian tube blockage, is the highest type of infertility that a woman will have, because I would say that this doesn't have remedy apart from God and IVF. So when the tubes are blocked, it means that there's no entrance, there's no way that the sperm and the egg can meet and fertilize. Fallopian tube, every woman have fallopian tube too. I have two fallopian tube. You that is watching me, if you're a woman, you have a fallopian tube too. So if one is blocked, you can still get pregnant with the other one. But in a situation whereby the two is blocked, it means that the door has been shut. So if the sperm swim and get to this point where it's supposed to meet with the sperm, with the egg to fertilize it, and the door is shut, the sperm will stay there until after five days, depending on the sperm, the type of chromosome or male or female chromosome sperm that will release. If it is male chromosome, the lifespan is 3 days. A female chromosome may last for 5 days. So when 5 days expires, this sperm will die. And the egg lasts for between 12 to 24 hours. So if the egg dies, then every month you'll be believing, hoping that you become pregnant. But you don't know that the entrance where the sperm and the egg will meet have closed. So you will not become pregnant. That is the highest, like I said before, highest type of infertility, tuber blockage. If you are just joining us, we are talking about infertility in women. I have talked about what infertility means, that if you are a woman, you have been sleeping, having unprotected sex, that is, you didn't use condom to close yourself, you have been having sexual intercourse for a year and nothing has happened, you didn't become pregnant, you are being considered as infertile during this month, not forever infertile. So we talked about that. Then now we are explaining the factors, the possible factors that causes infertility in women. I talked about this one, number one, tuber blockage. I talked about fallopian tubes. The role of fallopian tubes in every woman is a place where the sperm and the egg meet to fertilize. In the situation whereby the two tubes are blocked, so there is no way the sperm and the egg can meet to be fertilized. The second one is uterine fibroid. Women who have this uterine fibroid, they always find it difficult to conceive. Although women with uterine fibroid, some of them become pregnant, depends on the sizes. Uterine fibroid simply means fibroid inside your womb. So most of the women, when the fibroid is about 5, 6, 7 centimeter long, it will prevent them. What does it mean? This fibroid will go and sit in your womb, occupying the place where the baby is supposed to stay. That is why women who have fibroid, I don't always encourage you to, depending on the size, if it is big, whether it's big or small, once you become pregnant, the fibroid will continue to grow, because fibroid feeds on estrogen. And if you become pregnant between your first trimester, your estrogen will keep rising, which means the fibroid will be growing. And this fibroid, eventually, if you become pregnant with this fibroid, the fibroid and the zygote, when the egg is fertilized, it turns into a zygote. The fibroid and the zygote will be fighting, dragging themselves. The baby will say, "This is my place." The fibroid will say, "This is my place." They will be pushing each other. Anyone that wins goes away. If the fibroid pushes the baby away, the baby will go. If the baby pushes, which means the baby implants successfully, feel comfortable, then the baby will stay. But if you become pregnant with fibroid, uterine fibroid, it's not going to be easy for you. You will undergo series of pains. You will live in pains. You will live in fears, because, as you know, have you seen where two strong people, two lions are fighting? Because this fibroid will be trying to, dominate. The baby will be trying to dominate. Sometimes you'll be seeing bleeding, and once some of you become pregnant and you start seeing the blood, you'll be afraid. Before you know it, you will develop anxiety plus pains. It may lead to early miscarriages. So fibroid inside the uterine, inside your womb, is not good. If they said the fibroid is outside your womb, you don't have problem. You can give birth your baby because it doesn't disturb the baby. But the one we are talking about that cause infertility, it causes infertility in the sense that you might be pregnant but you continue to have miscarriages because this fibroid will keep on pushing your babies away. And even if you are pregnant, if you become pregnant with it, if the baby decides to stay, it's going to be like a hell to you because you will not enjoy the pregnancy. You will live in pains, bleeding, anxiety, uncomfortable. So it's better you treat it before you become pregnant. The number 3 causes of infertility in women is hormonal imbalance. When you have any of your hormones not well balanced, is going to affect you, such as thyroid. If you have on the thyroid, that is hypothyroidism. If your thyroid is high, that is hyperthyroidism. It's going to affect you. If you have hyperprolactin, whereby your prolactin is high. Prolactin is responsible for breast milk. Like I give birth now. You see breast milk coming out from my breast is hyperprolactin. Within this moment, I might not be ovulating. But if you are not pregnant and you are not breastfeeding, you see breast milk, not water, please. Not water, because some people misunderstood me. Not water. You see, please, I want to be seeing like. You people should be clicking on the like button so that people will be notified. This topic, this thing that I'm making here, if I want to go for a conference, I charge money to talk about it. I cannot be talking about it and it's only 18 people that is watching me. Please share. In as much as I'm doing charity work here, people must listen to me. For me to abandon, I didn't sleep throughout last night because the baby did not allow me, but still I make a chance because this was a question somebody asked me. So at least 100 people supposed to be watching this for me to be motivated. So if you are not pregnant, you are watching me right now, you are not pregnant, every time you see breast milk coming out from your breast, you have what is called hyperprolactin, which means your prolactin level is very high, and it will cause infertility because you will not be ovulating. If you have low progesterone helps to support pregnancy. If you have estrogen problem, estrogen thickening the lining of your uterus, once the egg is fertilized, estrogen goes to prepare a place for the baby by thickening the lining of your uterus, where the newly fertilized zygote will implant when the zygote arrives. But in a situation whereby you have low or high estrogen, is going to affect you because the zygote will reach there, and it's just like you when you are expecting a visitor in your house. What do? You clean your house, right? You clean everywhere, cook, make sure that everywhere is well prepared so that when these people come, they will, maybe that is not the way you were before, but then for the fact that these people are coming, you need to put your house in order so that these people will not say, this woman is a very dirty woman. So that is how estrogen, what is the function of estrogen in your body. You can also go and read about all these things that I'm saying. I'm just bringing it to your notice. I'm not going to details. I don't want to use medical terminologies here because it will be a waste of time. So if you want to know all these things, when you come, see me. I have my pen. This is my paper. I prepare anything that I teach here. Always come with your pen and paper. Not coming here, looking my mouth, looking at my English. My English, I am trying. Here I speak how many languages? I speak Dutch. I speak English. I speak my dialect. Sometimes I switched. So And I'm trying to hold myself to speak because I know that according to my distance, most people that watch this video is from Africa. So I speak like an African woman, in fact, like an Igbo woman, so that you understand me. But I can't speak when I'm speaking to an American. I change my accent. So some people cannot manage it. So when they are speaking, some of you will say, she's forming. No, she's not forming. You have to adapt to the environment you are. I cannot be speaking to an Englander or American like the way I'm speaking with you. They wouldn't understand me. I need to speak fast so that they will understand me. So if you do not understand me and I use the most simplest English, if you say you don't understand my English, you know you are lying. I use the simplest English so that a layman can understand what I'm saying. So we are talking about now, the first one, I talk about the factors that causes infertility in women. I talk about tube blockage. If your fallopian tubes, we are going to do physical remedy, but stay tuned, do not go away, watch this video. If you have been trying to conceive, stay here, watch this video, don't click and go, share, like, click on that red button. I want this video to be 100 people to be here. Like button, the essence is for people to be notified. Once you like it, Facebook will notify all those people that are following me. So always share. Once the estrogen, okay, I was talking about estrogen. Now the egg is fertilized and the egg will be going down to your fallopian tubes where it's going to implant. Let's assume that you have estrogen problems. You know, it means that the lining of your uterus, I wish I can demonstrate this live in a video, is not prepared. Then the zygote will get there, and there is no place. Just like when you have a visitor, the person comes to your house, you refuse to open door for the person wouldn't come in, right? That is the same way. If the zygote got there and there's no place to attach itself or to implant, they will stay there and disintegrate. The next thing, your period will start. So another cause of infertility in women is hormonal imbalance. You have been trying to conceive. Have you checked your hormones? Especially when you are 35, you should make sure that your hormones are very well balanced, especially all the 4 types of hormones that I mentioned. Thyroid gland, whether it is hypo. When it's hypo, is underactive, is low. When it's hyper, is excess. You check your prolactin level. If your prolactin level is high, try to find out why your prolactin level is high. There are many factors that can make your prolactin to be high. Stress can be it. Be one of the reasons. When you have your blood sugar level is high, it can. Some people will always ask me, I always see breast milk, or my prolactin level is high, what can I take? Don't take anything. The best thing you can do to yourself is to find out. Go and find out. Go and meet endocrinologists. These are these are people who are very conversant or responsible for endocrine hormones. They will take your blood, make a test, and find out what exactly. If you lower it, that is, if you can tell yourself the truth. If when you become pregnant the first time, you were TTC, that is, you struggle to become pregnant, then after that you want to conceive the second one, you find it difficult. That means that you did not solve the problem. You didn't solve the cause of your problem. That is why you are experiencing it the second time. And by this time, you are being carried away. You don't you didn't remember what you did that helped you to conceive at the first place. So this becomes a problem now to become pregnant for the first time. But if you solve the problem from the root, whenever you are free. For example, if you have hyperprolactin, maybe your doctor will prescribe, or like some of you ask, you take something to lower it, and you become pregnant, maybe after 2 years or a year, these things have been flushed out of your hair, you cannot remember, and the ailment is still there. It's not only for conception. This hyperprolactin, if you don't solve it, it can affect your kidney, it can affect every other of your health. So it's always good to solve the problem. So now let's look at another cause of infertility in women. We have cyst. We have what is called ovarian cyst. What is cyst? Cyst is a sac filled, is a sac filled that is always in every woman. But when after your menstruation, then the follicle will start to grow. Now, when this follicle grows, they are supposed to be ruptured. That is, they're supposed to burst. They are supposed to be released. So any of them that did not release will now turn into what is called cysts. Cysts have many kinds. So when you have been diagnosed with ovarian cyst, please always ask them what type of cyst, what is the size of the cyst, so that you will know. Some of you, when they tell you you have cyst, you'll become afraid, you'll be shivering without knowing that maybe the cyst you have is just a minor cyst. We have formula, we have a follicular cyst. These ones are normal. Or maybe if it is in Europe here, when you have cyst that is not dangerous, that is not threatening, the doctor will tell you that they will go out within 3 to 2 cycles. But if you have what is called diamond cyst, this is the one that requires surgery, that requires attention, that can cause infertility, that can cause you not to have comfort, and they are always big. So follicular cysts are those cysts that forms after your menstruation. Then if they did not rupture, that is, if you did not ovulate, is the remaining of your ovulation that didn't remain, they are supposed to go out within 3 of your cycles. So in this regards, you don't need to do anything. So anytime you are told that you have a cyst, when you have a dangerous cyst, if you pay attention to your body, you will know. When you have this diamond cysts are very big, from 4, 5, 6, and you always have menstrual pains. You always have pain during your lower abdomen. You have heavy bleeding. You always have pains during your menstruation. So you know you have this, and this can be removed only through surgery. And one thing I don't like about cyst and fibroid is this: surgery is not the solution to fibroid and cyst. The solution is, one, avoid those things, because these things, they grow from estrogen. If you have fibroid, for example, you are eating milk, dairies, I'll put them under dairies, like milk, cheese, sugar, cola, all these sweet things, you are killing yourself, because this fibroid feed from estrogen. The same thing applicable to somebody who is suffering from cyst. So if you have cyst, maybe later I'm going to make a video about the food people who have. I think I have made a video, the easiest way to shrink fibroid, or to, if you can take this thing that I'm going to be demonstrating, then you avoid this video. I have made a full detailed video on that. Maybe I will look for it and post it again. So if you have this cyst, if they tell you have cyst, ask them the size, the type, and the position. The next thing that can cause infertility in women is what is called cervical inflammation. Whenever there is inflammation, infection in the cervix, it can cause infertility. And system of this cervical inflammation is pains during sex. Do you always have pains whenever you are making out with your partner, please go and check yourself. Another thing that can cause infertility is what is referred as PTD. Simply means pelvic inflammatory diseases. These can cause infection, and infection can also cause infertility. Do you know that? Infection can cause infertility. Stress can cause infertility. I'll make a video to encourage all the women that are trying to conceive. Most of you that is watching me now, you don't have problem, but your problem is stress. And if you don't stop stressing yourself, you will not become pregnant. So, infection can cause infertility in the sense that when you have infection, for example, like staphylococcus, yeah, if you have them, you did not treat them, they will block your tubes. I have made video on the causes of tube blockage. If you have tube blockage, go and watch it. Tube blockage, infection, untreated infection can cause your tubes to block. I remember what I said about tube blockage. Now let's go to practical aspect of it. But I am not happy that it's only 28 people that is watching me. So I know you that is watching me, you know what this thing is. Can you see this thing? Can you see it? If you can see it, please someone should write yes so that I will continue. My time is almost up. Can you see this thing in? Can you see this thing, please? Can you see it? I want somebody to respond. I hope it's human beings that are watching me. Please, yes, yes. Can you see it? I need a yes. I need a yes before I continue. If you can see it, you say yes. Okay, thank you. Thank you, Ezekiel. So this is called Negro pepper. Negro pepper. I don't know the name in Igbo, but please, if you know the name in your language, you can write it. Right now, like you see this one, I am drinking it now. I am drinking. This is very, very powerful. In fact, God created everybody. When God created this world, I think we spoiled this world by ourselves. Yeah, okay. Preach good. Thank you. Say order. Is this what they call order? Is this order? Thank you, my sister. I will give you chewing-gum 1 naira. Okay. Any perfect say yes. Please be writing the name in your language. If you are Yoruba, Cross River, Ghana, any country you come from, at least I have shown you people this. Please call the name. I don't know the real name in Igbo. I don't want to give false information. So this is Negro pepper. This is very, very powerful. You know, our people don't like eating something that will strengthen or lengthen or make us healthy. We like eating things that kills, like cola. If you say take cola, like I mentioned about the other one, iodine this thing. Somebody was telling me if I drink it, I vomit. You will vomit, but if you drink Coke and Fanta, do you know how many sugar and acid in those things you are drinking? So now this thing is very, very powerful. Is medicinal. Igbos has a lot of medicine. This thing is medicinal. And the problem people have, when you tell them to do something, they will do it just a day, 2 days, 3 days. They expect it to work like that. This is not chemicals. The reason why when you are sick, you take paracetamol, within some minutes the paracetamol disappear is because there is something added to it that makes it to act fast. But this one is natural. The way it is, it works gradually. And one thing I like about all these things, you can use them to cure many things. So this thing is very rich in, I don't want to start mentioning the function in the body, but I'm telling you the honest truth. that this thing can make you to get pregnant. Right now, this thing I showed you, I'm using it almost every day. Almost every day. I add it in my food. I drink it as water because it helps to cleanse my system. It helped me to be strong. So, like people who have fibroid, cyst, infection, some people are looking for all this medicine. I call them chemicals. Some people are looking for chemicals that you will write to them, they will go and buy. But these are natural one that after taking it, your entire system will come together. You will feel it. So this is Negro pepper order gift are reserved. You people have saved me. So I have Igbo people here. Lovett said in Igbo is called order. Wow, I don't know that I have Igbo people here. So many Igbo, sorry. So this is Negro pepper. This thing is very, very good. One, it fights against inflammatory. This thing fights against inflammatory. This thing helps your health. For example, people who have fibroid and cyst, this thing and fibroid is enemies. People who have infection, this thing and infection, they are enemies. For people who tubes are blocked, minor tube blockage, we have many types of tubes. There are people that their tubes are blocked very hard, that they need surgery. But there are people whose tubes blocked minor. What they need is just a little bit push, then their tubes will be open. This is for you. So how do you use this? People who have not seen their menstruation, this is for you. So how do you use this? This is my cup. I always use glass cup. So this is my glass cup. What you will do, I think if you are in abroad, people will say, where can I get it? Thank God that you people are the one that tell me the Igbo name now. So look for it wherever you are. Don't tell me this one, they brought it from Nigeria. I don't miss this thing. This thing, if you see it, you will think I'm in Nigeria. It's full at my home. I don't joke with it. Even when I'm not pregnant, I use this thing to cook pepper soup. But if you are pregnant, please don't use this. This thing can flush your baby away. Don't use it if you are pregnant. I'm talking about people who want to be pregnant already. So what you will do is this. This is it. You will take 2 handfuls. I'm using this one for the sake of this paper. After this thing, I'm going to remove it. I will still use it. I'm not going to pour it away. So do you see it in my glass cup? I soaked one, but I'm going to remove this one. This is the one that I soaked before. I'm going to pour it here. I hope this thing will not pour water here. So you are going to take your handful 2 times, especially people who have fibroid. This one, you see the color, but the time is not, when I supposed to leave it is not yet time. But I'm doing this for the sake of this video. The ones I drink, I always do it so that it will be many. I drink it. So you soak this thing. Before you do that, wash it very well, because I know that the place they are bringing this thing is I'm sure it's not healthy. So you take 2 full of your hands like this if you are in Nigeria. But if you are in Europe, you can take small like me, because if it got finished, you don't know when. Yes, Obenna, don't worry, Amara. When I finish, you ask. I always give opportunity for question. I'm almost done. So if you are like me here, take 1. But if you are in a place like Nigeria, Africa, where you can buy it anyhow, You can take as much as you can. Soak it in the water. Soak it. This is my hot water. I don't want to waste the other one because I have already wasted this one. So I'm supposed to pour water here, but I cannot because I have already soaked this one. You pour your water. Do it with big, not with glass. Pour it in a big bowl because you are going to use this thing 2 times in a day. So when you wash this negro pepper, after washing it, then you put it in a bowl, boil hot water. After boiling the water, you pour the water inside the bowl. I didn't say glass now, bowl, because you need to be many because you need to take it. Sometimes I forget myself. I take it more than 2 or 3 times a day. I use it as my water. So you soak it, leave it for 10 hours. But I will advise you to leave it a day so that the nutrient will come down. Like this one, I soak it since morning. I don't know if it is up to 10 hours. So when it's settled, if you see it, the color have not fully, it's not fully out. So you leave it for 10 hours. If you can, do it a day. Then what you should do, the ones you have used before, you can reuse it again. Like this one now, I'm going to, what I need to do, if I boil hot water, I will refill the water again. The thing is sweet. What I like, do you know what I like in this? The smell. The smell, when I'm drinking it, is the smell that I like. I like the smell. If you use it for pepper soup, wow. You can always use it for your pepper soup. Everybody, it's not something that affects, apart from somebody who is already pregnant. If you are not pregnant, you can take it. So when you soak it like this for 10 hours, if you cannot have patience, then drink it first thing in the morning, after brushing your teeth. Let no water go down your throat. Drink it first thing in the morning and last thing before you go for bed. Like I said, I mentioned people who are supposed to use this. People who want, if you want to, people first, the people that are in a greater position, people who have fibroid, cyst, PCOS. Yes, I didn't even finish mentioning the causes of infertility. Yes, let me mention it before I come back to this. PCOS simply means polycystic ovarian syndrome. Have you been told that you have PCOS? Simply means that in your ovaries, in your womb, whenever you hear ovaries, it's womb. In your womb, there are multiple follicles. These follicles, I think, where is my phone? I need to show you people. I have been showing this thing several times. Let me show you what PCOS looks like. So in your womb, you have multiple follicles. I'm coming. You have multiple follicles in your womb. Every month you are not ovulating, not even men. Oh, where is this coming? Okay. Every month you will not be ovulating. So this is a practical example of PCOS. You see, after your menstruation, when you enter your follicular phase, the eggs supposed to be growing. So after during ovulation, these eggs will now, they will develop, they will grow. At the end of the day, 1 or 2 of the eggs will burst, will be released. But in the issue of PCOS, you see them, these are the follicles. They are not growing, they are just like this. Spoiling your womb. They are not like this. They will not grow, they will not mature, they will not release. So it's just like keeping somebody stagnated. So now, if you have this PCOS, for example, some people in Nigeria, they will tell you that your womb have spoiled, that you cannot become pregnant, but it's a lie. So all you need to do, if you have this, like you see, look at another picture of it. This is the left ovary. This is the left ovary, this is the right ovary. So, and if you have this PCOS, you experience painful menstruation, you will not be ovulating. Sometimes you have irregular periods. Sometimes you have irregular menstruation. Your menstruation will not be regular, and you may see it this month, next month you will not be seeing it. And the most important thing here, difficult thing here, is that you do not ovulate. You will not ovulate because of these follicles. They are not growing, they are not maturing. You will not ovulate. So PCOS is one of the factors that causes infertility in women. Now we'll have another one. I forgot to mention them. We'll have another one called endometriosis. Endometriosis. Now, what is endometriosis? Endometriosis happens when a tissue that's supposed to grow inside your uterus, inside your womb. This is the picture of endometriosis. Now, this thing is supposed to grow inside your womb, but they leave the place that they are supposed to grow. Do you see where they grow? These are tissues that are supposed to grow inside your womb, but they came to grow outside your womb. Now, when this happens, you will find it difficult to conceive, and you also have painful ovulation. Look at the picture of big endometriosis. I don't know if Facebook allows such picture. So these are the things. You have painful menstruation, you have painful sex when you are baby dancing. Endometriosis is a disease characterized by the presence of tissue resembling endometrium, the lining of the uterus, outside the uterus. It causes a chronic inflammatory reaction that may result in the formation of scar tissue. So what I just show you, this last one, is the picture of endometriosis. This is another thing that causes infertility in women. But the problem most of the women have is that they have this problem, but they did not they have this problem, but they do not know. And this is why I am here, to bring it to your notice, as I'm showing you, telling you, you should. Jesus Christ, only 6 people share this program, and I'm here talking since. God, 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 God. 28 people, only 6. Please, if you are here and you are listening to what I'm saying, you haven't shared this program, God is seeing you. That is all I can say. If you are here, you are watching this program, you are learning, and you haven't shared this program, God is watching you. God is watching you. 29. There was a time this thing got up to 33. Only just 6 shares. Let me ask you people, if you share this program, does it cost you anything? If it costs you, please do not. But if it doesn't cost you, please share this program, like this program, so that other people will learn. I will cut the video. Because of this, I will not answer any question. Because of this, I saw now, I will not answer any question. I will just say complete the video. So this thing, you take it first thing in the morning. First thing in the morning before you eat anything. Then 30 minutes later, you can eat. I will repeat myself. Take this first thing in the morning before eating. Then after 30 to 40 minutes later, you can eat. And also take it last thing at night before you go to bed. So this is where I will end this program today. I am not really happy on what I saw. 33 people, nobody shares. If you want to ask me question now, you must pay. Also, they will share. Are you speaking for them? There's somebody I'll ask question. Please, can you ask your question before I go? I will not be answering any other question because I promise her that I'm going to answer. The person that says she have a question, I am waiting for you. You continue to take it. As you are taking it, this is a very important question. Mercy, love. Mercy, God will keep on blessing me, but you people need to make me happy too. Mercy, you need to make me happy by sharing the video, recommend the page. The essence of this page is to help women who are struggling, because I've lived with people who passed through this. I said I was going to help people. So if I'm helping you, you should help others. I didn't say you should pay me money. No, help, share so that people will see. So you say God will bless me. God have already blessed me, but you need to make, I'm a human being. Oh, sometimes when I get angry, people will say, why? I am a human being. I have not said to you people that I'm God. It's blood that runs in my veins. So I am reacting the same way you should react if you are in my position. My please, I know you might have said it several times. Please, I want to know what could be the problem of a lady that ovulate but the cervical mucus is always absent. It does not flow out. Though, let me read your message properly. It does not play out. Does not flow out. Though the abdominal pains always occur. And what can I do? So you said you are not seeing your cervical mucus. Who wrote Obonna Amara, do you know how you know that you are ovulating? Do you use OPK? I hope you are here now, not when you ask question you run away. I'll be talking to myself. um do you use OPK? If yes, you use OPK, please go and use ultrasound after your menstruation. Be using OPK. When you think it's closer, go and use ultrasound. I think there is many doctors in Nigeria that use ultrasound to track your follicles, your egg. So the doctor will tell you whether you ovulate or not. This is the best way, because sometimes when you use fake ovulation prediction kit, they will be telling you, showing you positive, while in the actual sense you are not ovulating. Or the best way, buy clear blue ovulation kit, prediction kit. That is the one that is 80 or 99 accurate. So when you see it, which means, like I said before, it's not only ovulation that decides whether you become pregnant. If I don't know when you joined us, the four hormones I mentioned, if any of them have problem, is going to affect you seriously. So the best thing to satisfy yourself and your conscience is, one, go for hormonal test. Like you said, you ovulate. The cervical mucus is a very good sign that you are fertile, that your body is in order. If you are not seeing it, it's telling you something. It's telling you that it's telling you something. You notice it that whenever you are baby dancing, you don't feel it, because that thing is something that God have designed. One, the role of that cervical mucus is to it have two functions. One is tells you that now your body is ready, your body is fertile to carry a baby. Then the second thing, it helps the sperm to swim and also helps you to enjoy the intercourse. It prevents you from, imagine when your women's vagina is acidic in nature. So when you are dry, which means your body is not alkaline, but this cervical mucus and the reaching orgasm helps your body to be alkaline, then it helps you to enjoy the baby dance, and also helps this sperm to travel fast to fertilize the egg. So I will advise you, this is my personal opinion, but you might do the one you like. I will advise you to go and use OPK. Use OPK go and use ultrasound. Tell them you want to track your egg. You want to know if you ovulate, so they will watch it out. But you need to do hormonal